Hello from Washington, everyone. I wanted to send a little video to you guys to show you some of the eye exercises that we do in the PT clinic that help patients with concussion or TBI. So your vestibular system a lot of times is affected when you have a head injury, and the vestibular system tells your brain what your head is doing in space, independent of your visual system, but it does use the information from both the vestibular and the visual system to kind of conjoin so that you don't feel dizzy like vertigo. One of the easiest exercises that we do is what's called a pencil push-up. So you either take a pencil or you can even take your thumb and you want to do convergence and divergence. You want to go as close as you can without that object going into double vision, and then go as far away from you as you can. I'm going to do about 15 to 20 of these. The next two exercises are super common. They're called VOR times 1 and VOR times 2. VOR is the vestibulo-ocular reflex. You should be able to focus on something while your head's moving, and your brain should be able to kind of understand that information without taking you into Disneyland. So VOR times 1 is you take that point, you can even put a sticky note on the wall, is what we do in the clinic a lot of times, and you're gonna wanna rock your head back and forth about 30 to 45 degrees. You want to do 120 hertz, so it's about 2 per second. And that's important because that's the frequency with which your vestibular system communicates up the 8th cranial nerve, the vestibulocochlear nerve, to your brain. So 2 per second. So it's VOR times 1, turning side to side. VOR times 2 is going to be your eye movement. So first one's head movement, second one's eye movement. You take 2 points at about 30 degrees off from the center of your face, and you want to have the eyes go back and forth about 2 per second. So those are really, really helpful ones. Another helpful one is going close vision to far vision. So you take that point, a lot of times I'll have people use the thumb, focus on your thumb, move it out of the way, look at something far. Close, far, close, far. So eyes are having to focus far and then close, back and forth. Another one you can do is what's called smooth pursuits. So without moving the head, you want the eyes to track side to side smoothly. Now I'm getting a little more advanced. Without knowing your patient, I can't really recommend something specific, but a lot of times what we'll do is we'll find where that nystagmus, that rhythmic beating of the eyes, occurs in which quadrant of the vision. So say it's in my upper right quadrant. When I look up like this without moving my head, my eyes give a little bit of that shakiness. So focusing on that quadrant, you can do VOR times 1 and times 2. So keeping your head straight ahead, I'll look up, straight ahead, look up, straight ahead, 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 and going for that 2 per second frequency. And then the last one that you want to do is going to be point your eyes in your face at that point in the upper right quadrant, and then drag your face down to the left, back up. So what that's doing is it's keeping your eyes fixed on that object in the upper right quadrant while moving your head away from it. If you guys got more questions, just shoot me an email. You can see my email on the thread. Hope you're all doing well.